Hi, I'm Amanda Armstrong with Hillcrest Healthcare System. Today I'm joining you from the emergency department in Cushing at Hillcrest Hospital Cushing to talk to you about how technology is helping to improve patient care and access to providers. Today joining me from Tulsa is Dr. Ziad Sous, and we are going to talk about how this robot named Sheldon can do exactly that, improve patient care and access to providers. Hi, Dr. Sous.
Hi.
Tell me how, by using Sheldon, you're able to improve patient care here in Cushing.
Well, the idea of really having telemedicine and having the robot present in Cushing emergency room is to try to evaluate the patient in timely fashion by physicians who are specialized in whatever is needed for the patient care, and trying to keep those patients in the community if we can. In the old days, prior to having that technology available to us, most of those patients will be transferred to the higher level of care facilities like Hillcrest, and sometimes unnecessarily. So what we're trying to do is trying to keep those patients close to their loved one and in their community and be cared for by the same level of care as we provide at Hillcrest.
Talk to me about how you're able to interact with the patient. What can you see and what can you do?
In typical physician-patient relationship, you really are able to see and touch and listen. We can do almost all of that short of touching. We can see the same thing and actually in a better quality. This is high definition cameras are attached to the robot. That's we can visualize everything in the patient closer to their pupils, to anything you can think of, any skin lesion. And we have a capability with a stethoscope digitally attached to the robot that I can listen to the heart and the lungs, to the abdomen if I needed to, and I can have a better quality of actually magnified sound, if you may. It's better than even really being on a bedside and sometimes.
How do nursing staff and other providers here in Cushing help complement the care you're providing through Sheldon?
Definitely the nursing staff is an integral part of caring for those patients down there. So one of the nursing staff will be present with us with the patient to basically witness what we're doing and help complement what we do, meaning help me place the stethoscope on the patient, on the chest and the lungs, on the heart, and also they help me feel the abdomen and where I'm witnessing what they're trying to do and direct them where to push and ask the patient how they're feeling. So it's basically they become my hands on the scene.
And if a patient comes to the emergency department here in Cushing and they see you through Sheldon, but perhaps they need additional care and need to be transported to Hillcrest Medical Center in Tulsa, how does seeing them through Sheldon here in Cushing help improve their care once they get to Tulsa?
Okay, well, I mean, this great question also. First, the early identification of the need for patient to be in a higher level of care is that where we come in and help the emergency room staff assessing the patient and identifying those cases. Two, early identification means early intervention, and that's what we do. We start the ball rolling and start really the care plan early on in Cushing. So by the time they get to Hillcrest, we're already midway in treating the patient. And also what we do is alert the necessary subspecialist at Hillcrest with the case and what's happening, so they have a head start from our end, and having the necessary staff available to receive the patient if they need really any intervention.
Okay. Well, thank you, Dr. Sous, for your time. It was great to hear this really important information for the community of Cushing. It was a pleasure visiting with you and Sheldon today.
Thank you. Thank you very much for this opportunity.
From Hillcrest Hospital Cushing, I'm Amanda Armstrong.